Question 1. A pharmacy technician receives a prescription for oxycodone. Which DEA form is required for ordering Schedule II controlled substances? I. DEA Form 41. B. DEA Form 106. C. DEA Form 222. D. DEA Form 224. Answer C. DEA Form 222. This question tests your knowledge of federal law regarding controlled substances, specifically the forms used for ordering. The keyword Schedule II controlled substances is crucial because these drugs have strict ordering requirements due to their high potential for abuse. DEA Form 222 is the official document used by pharmacies to order Schedule II narcotics, ensuring a secure and traceable process. For instance, to order oxycodone or morphine, a pharmacy must complete this specific form. Remember, proper documentation for controlled substances is essential for legal compliance and patient safety. Question 2. A prescription calls for amoxicillin 250 mg per 5 milliliters. Take 5 milliliters orally 3 times a day for 10 days. What is the minimum volume of amoxicillin suspension, in ml, that should be dispensed? I. 75 milliliters. B. 100 milliliters. C. 150 milliliters. D. 200 milliliters. Answer C. 150 milliliters. This question tests your ability to calculate the total volume needed for a medication, a common task in pharmacy math. The keywords are 5 milliliters orally 3 times a day for 10 days, which indicate the dosage and duration. To find the total volume, first calculate the daily dose, 5 ml/dose * 3 doses/day equals 15 milliliters per day. Then multiply the daily dose by the number of days, 15 ml/day * 10 days equals 150 milliliters. Therefore, 150 milliliters of the amoxicillin suspension is required. Always double-check your calculations to ensure the patient receives the correct amount of medication. Question 3. What is the generic name for the brand name drug Plavix, commonly used to prevent blood clots? I. Atorvastatin. B. Clopidogrel. C. Metoprolol. D. Warfarin. Answer B. Clopidogrel. This question assesses your knowledge of common brand generic drug names, specifically for a medication often found on the top 200 list. The keyword Plavix should immediately bring to mind its generic counterpart. Clopidogrel is an antiplatelet medication, meaning it helps prevent blood clots by making platelets less sticky, and it is frequently prescribed for patients at risk of heart attack or stroke. While warfarin also prevents blood clots, it's a different class of drug and not the generic for Plavix. Knowing these common brand generic pairs is vital for safe and accurate dispensing. Question 4. Which of the following is the most critical step to prevent contamination when preparing sterile compounds in a laminar airflow workbench, LAFW? I. Wiping down the LAFW with alcohol after preparation is complete. B. Wearing sterile gloves and a gown only. C. Performing proper hand hygiene and garbing before entering the buffer area. D. Placing all necessary supplies into the LAFW at once before starting. Answer C. Performing proper hand hygiene and garbing before entering the buffer area. This question focuses on quality assurance and sterile compounding principles, specifically contamination prevention. The keywords most critical step emphasize the importance of foundational practices. Proper hand hygiene and thorough garbing, donning sterile attire like gowns, gloves, masks, and hair covers are the primary barriers against microbial contamination from personnel. While other steps are important, failure to adequately clean hands and properly don personal protective equipment introduces the greatest risk of introducing contaminants into the sterile environment. Remember, you are the biggest source of potential contamination in sterile compounding. Question 5. Under federal law, how often must a complete inventory of all controlled substances be taken in a pharmacy? I. Every 6 months. B. Every year. C. Every 2 years. D. Every 3 years. Answer C. Every 2 years. This question tests your knowledge of federal law concerning controlled substance inventory requirements. The keyword controlled substances highlights the strict regulations governing these medications. Federal law mandates that a complete inventory of all controlled substances, Schedules 2V, be taken at least every 2 years. This biennial inventory helps ensure accountability and detect any discrepancies in the pharmacy stock. It's also important to remember that state laws may require more frequent inventories, so always follow the stricter regulation. Question 6. A patient needs 2 tablets of a medication twice daily. The prescription is for a 30-day supply. How many tablets should be dispensed? I. 30 tablets. B. 60 tablets. C. 90 tablets. D. 120 tablets. Answer D. 120 tablets. This question is a straightforward pharmacy math calculation for determining days supply or total quantity. The key phrases are 2 tablets, twice daily, and 30-day supply. First, calculate the daily dose. 2 tablets per dose multiplied by 2 doses per day equals 4 tablets per day. Then, multiply the daily dose by the number of days. 4 tablets per day multiplied by 30 days equals 120 tablets. This simple calculation is fundamental for ensuring patients receive the correct amount of medication. Question 7. Which of the following is the brand name for sildenafil? I. Levitra. B. Cialis. C. Viagra. D. Staxin. Answer C. Viagra. This question assesses your knowledge of common brand generic drug names, particularly for a well-known medication. The keyword sildenafil refers to the generic name for a phosphodiesterase 5 PDE5 inhibitor. Viagra is the most recognized brand name for sildenafil, commonly used to treat erectile dysfunction. While Levitra, vardenafil, and Cialis, tadalafil, are similar drugs, they have different generic names. Knowing these connections is important for accurate order entry and patient counseling. Question 8. A pharmacy technician enters a prescription into the computer system. The prescription is for insulin glargine 10 units daily. However, the technician accidentally inputs insulin glucosine 10 units daily. This type of error is best described as a I. Transcription error. B. Dispensing error. C. Prescribing error. D. Administration error. Answer I. Transcription error. This question addresses a common type of medication error, testing your understanding of error classification and patient safety. The crucial information is that the technician accidentally inputs a different insulin name than what was prescribed. A transcription error occurs when information is incorrectly entered from one source, the prescription, into another, the computer system. A dispensing error would be providing the wrong medication to the patient, while a prescribing error occurs at the doctor's office, and an administration error happens when the patient takes it incorrectly. Careful data entry is vital to prevent these types of errors. Question 9. Under HIPAA, which of the following is generally not considered protected health information, PHI, when de-identified? I. Patient's medical record number. B. Patient's full name. C. Patient's occupation. D. Patient's date of birth. Answer C. Patient's occupation. This question tests your understanding of HIPAA regulations, specifically what constitutes protected health information, PHI, and what might be considered general information. The keyword de-identified suggests that direct identifiers have been removed or altered. While medical record numbers, full names, and dates of birth are all direct identifiers used to link information to an individual and therefore PHI, a patient's occupation, by itself, is typically not considered PHI unless it's explicitly linked to their health condition or other identifiers. The core idea is that PHI is information that can identify an individual and relates to their health or healthcare. Question 10. How many grams of NaCl are needed to prepare 500 milliliters of a 0.9% NaCl solution? I. 0, 45G. B. 4, 5G. C. 9G. D. 45G. Answer B. 4, 5G. This question is a common pharmacy math calculation involving percentage strength. The key information is 0.9% NaCl solution and 500 milliliters. A 0.9% solution means there are 0.9 grams of solute in every 100 milliliters of solution. To find the amount for 500 milliliters, you can set up a proportion 0.9g/100 milliliters equals xg/500 milliliters. Solving for x, you get x equals 0.9 asterisk 500/100 is equal to 450/100 is equal to 5 grams. Therefore, 5 grams of NaCl are needed. Question 11. Which of the following medications requires a do not crush warning due to its extended release formulation? I. Metformin immediate release tablets. B. Amoxicillin capsules. C. Oxycodone ER tablets. D. Lisinopril tablets. Answer C. Oxycodone ER tablets. This question tests your knowledge of medication counseling points and formulation considerations. The keyword, extended release formulation, is the critical clue. Extended release medications are designed to release the drug slowly over time, providing a sustained effect. Crushing or chewing an ER tablet destroys this controlled release mechanism, leading to a rapid release of the entire dose, which can cause an overdose and serious adverse effects. For instance, oxycodone ER is a potent opioid, and crushing it can be dangerous. Always advise patients not to crush, chew, or break extended-release formulations unless specifically instructed by a healthcare professional. Question 12. A pharmacy uses a PAR level system for inventory management. What does PAR level refer to? I. The price at which a product is purchased. B. The point at which a product is returned to the supplier. C. The maximum quantity of a product to have on hand. D. The minimum quantity of a product that should be kept in stock. Answer D. The minimum quantity of a product that should be kept in stock. This question relates to inventory management, a crucial aspect of pharmacy operations. The keyword PAR level is an acronym for periodic automatic replacement, or sometimes simply refers to a set minimum. The PAR level represents the minimum quantity of a specific medication or supply that should always be available in the pharmacy. When the stock drops to or below this level, it triggers an order to replenish the item, preventing stockouts. Maintaining appropriate PAR levels ensures medications are available when needed without excessive overstocking. Question 13. The Poison Prevention Packaging Act, a PPPA, requires most prescription drugs to be dispensed in child-resistant containers. Which of the following drugs is exempt from this requirement? I. Ibuprofen suspension. B. Prednisone tablets. C. Sublingual nitroglycerin. D. Digoxin tablets. Answer C. Sublingual nitroglycerin. This question assesses your knowledge of federal pharmacy law, specifically the Poison Prevention Packaging Act, PPPA. The keyword exempt is important, as the PPPA has specific exceptions to the child-resistant packaging rule. Sublingual nitroglycerin, used for acute angina attacks, is exempt because a patient experiencing a cardiac event needs immediate access to the medication, and child-resistant packaging could delay critical treatment. Other common exemptions include oral contraceptives and effervescent aspirin. Knowing these exemptions is vital for dispensing compliance. Question 14. An 4 bag contains 500 milliliters of D5W to be infused over 4 hours. The 4 tubing delivers 15 drops/ml. What is the flow rate in drops per minute, GTTS/min? I. 25 GTTS/min. B. 31 GTTS/min. C. 63 GTTS/min. D. 125 GTTS/min. Answer B. 31 GTTS/min. This question is a classic flow rate calculation, a common pharmacy math challenge. The key details are 500 milliliters, 4 hours, and 15 drops/ml. First, convert the total infusion time to minutes. 4 hours * 60 minutes/hour equals 240 minutes. Then use the formula total volume in ml * drop factor in GTTS/ml/total time in minutes. So, 500 ml * 15 GTTS/ml/240 minutes equals 7,500 GTTS/240 minutes is almost equal to 31.25 GTTS/min. When rounding for 4 rates, it's common to round to the nearest whole number, giving you 31 GTTS/min. Question 15. Which of the following pairs of medications is considered a lookalike/soundalike (lossy) pair that requires special attention to prevent errors? I. Metformin and metoprolol. B. Lisinopril and losartan. C. Hydralazine and hydroxyzine. D. Warfarin and acetaminophen. Answer C. Hydralazine and hydroxyzine. This question addresses patient safety and the prevention of medication errors, specifically focusing on lookalike/soundalike (lossy) drugs. The critical task is to identify the pair that sounds and/or looks similar enough to be easily confused. Hydralazine, an antihypertensive, and hydroxyzine, an antihistamine, are a well-known LASA pair that often causes dispensing errors due to their similar spellings and pronunciations. Pharmacies employ strategies like tall man lettering, e.g., hydralazine versus hydroxyzine, to visually differentiate such drugs. Always double-check LASA medications to ensure patient safety. Question 16. What is the primary purpose of medication reconciliation during patient admission or transfer? I. To identify potential drug-drug interactions. B. To create a comprehensive and accurate list of all medications a patient is taking. C. To determine the patient's insurance coverage for medications. D. To educate the patient on proper medication administration techniques. Answer B. To create a comprehensive and accurate list of all medications a patient is taking. This question focuses on quality assurance and patient safety processes in healthcare, specifically medication reconciliation. The keyword primary purpose directs you to the core goal of this critical step. Medication reconciliation is a process of comparing the patient's current medication orders to all medications the patient has been taking, including over-the-counter drugs and supplements. The goal is to avoid medication errors such as omissions, duplications, dosing errors, and drug interactions by establishing an accurate and complete list. For example, when a patient moves from home to a hospital, their medication list might change, and reconciliation helps catch any discrepancies. Question 17. A pharmacy technician needs to verify the legitimacy of a DEA number. The second letter of a prescriber's DEA number should be the first letter of their I. Last name. B. First name. C. Medical school attended. D. Specialty area. Answer I. Last name. This question tests your knowledge of DEA number verification, a critical aspect of controlled substance dispensing and pharmacy law. The keyword second letter is the specific detail required. To verify a DEA number, you perform 2 checks. First, a mathematical calculation, and second, confirming the first letter matches the type of registrant FG, A, B/F/G for physicians, and the second letter matches the first letter of the prescriber's last name. For example, if Dr. Smith's DEA number starts with BS, the S should correspond to Smith. Question 18. A compound requires 73% ethanol, but the pharmacy only has 95% ethanol and 40% ethanol available. To make 1,000 milliliters of 73% ethanol, how much 95% ethanol in ml is needed? I. 300 milliliters. B. 450 milliliters. C. 600 milliliters. D. 667 milliliters. Answer C. 600 milliliters. This question tests your ability to use alligation, a common pharmacy math technique for compounding different concentrations. The goal is to make 1,000 milliliters of 73% ethanol using 95% and 40% ethanol. To solve this, let X be the volume of 95% ethanol needed. Then 1,000X is the volume of 40% ethanol needed. The equation becomes 0.95 asterisk X plus 0.40 asterisk 1,000X equals 0.73 asterisk 1,000. Solving for X, 0.95X plus 400 to 0.40X equals 730, 0.55X equals 330, X equals 330 slash 0.55 equals 600 milliliters. This means you need 600 milliliters of 95% ethanol. Question 19. Which common over-the-counter oats medication is known to significantly increase the anticoagulant effects of warfarin, potentially leading to increased bleeding risk? I. Acetaminophen. B. Ibuprofen. C. Famotidine. D. Loperamide. Answer B. Ibuprofen. This question tests your knowledge of common drug-drug interactions, a critical area for patient safety. The keywords warfarin, an anticoagulant or blood thinner, and increase bleeding risk point towards medications that affect blood clotting. Ibuprofen, a nonsteroidal anti-inflammatory drug, SAD, inhibits platelet function and can irritate the gastrointestinal lining, both of which can enhance warfarin's effects and increase the risk of serious bleeding. Acetaminophen, in contrast, is generally considered safer with warfarin at recommended doses. Always be mindful of potential interactions, especially with narrow therapeutic index drugs like warfarin. Question 20. When processing a prescription, a prescriber writes DA1 on the script. What does DA1 indicate regarding generic substitution? I. Dispense as written, substitution permitted if generic is available. B. Dispense as written, brand name medically necessary. C. Dispense as written, patient requested brand name. D. Dispense as written, pharmacist chose brand name. Answer B. Dispense as written, brand name medically necessary. This question tests your understanding of DA, dispense as written now codes, which are crucial for insurance billing and medication dispensing. The keyword DA1 specifically indicates that the prescriber has explicitly stated that the brand name product is medically necessary. This means no generic substitution is allowed. Other DA codes exist for different reasons, such as patient request or pharmacist choice, but DA1 is reserved for medical necessity as determined by the prescriber. Correctly interpreting DA codes ensures proper billing and patient care. Question 21. Which federal law requires pharmacists to offer counseling to Medicaid patients regarding their prescriptions? I. Pure Food and Drug Act of 1906. B. Kefauver-Harris Amendment of 1962. C. Omnibus Budget Reconciliation Act, OBRA 90. D. Dietary Supplement Health and Education Act, DSHA, of 1994. Answer C. Omnibus Budget Reconciliation Act, OBRA 90. This question tests your knowledge of significant federal pharmacy laws. The keyword counseling to Medicaid patients directly points to the Omnibus Budget Reconciliation Act of 1990, OBRA 90. This act mandated that states require pharmacists to offer counseling to all Medicaid patients about their new prescriptions, as well as perform drug utilization reviews. While OBRA 90 specifically targets Medicaid patients, the practice of offering counseling has since become a standard of care for all patients. Question 22. A child weighs 44 pounds. The prescribed dose for a medication is 10 milligrams per kilogram per day, divided into 2 doses. How many milligrams should the child receive per dose? I. 100 milligrams. B. 200 milligrams. C. 400 milligrams. D. 880 milligrams. Answer I. 100 milligrams. This question involves weight-based dosage calculation, a critical skill in pharmacy math, especially for pediatric patients. The keywords are 44 pounds, 10 milligrams per kilogram per day, and divided into 2 doses. First, convert the patient's weight from pounds to kilograms. 44 pounds slash 2 lbs slash kg equals 20 kilograms. Next, calculate the total daily dose. 10 milligrams per kilogram per day, asterisk 20 kilograms equals 200 milligrams per day. Finally, divide the daily dose by the number of doses. 200 milligrams per day slash 2 doses slash day equals 100 milligrams per dose. This calculation ensures the child receives a safe and effective amount of medication. Question 23. Which of the following medications must be stored in the refrigerator between 2 degrees Celsius and 8 degrees C in a pharmacy? I. Levothyroxine tablets. B. Azithromycin suspension after reconstitution. C. Atorvastatin tablets. D. Lisinopril tablets. Answer B. Azithromycin suspension after reconstitution. This question assesses your knowledge of medication storage requirements, which is vital for maintaining drug efficacy and patient safety. The critical phrase after reconstitution indicates that the medication is prepared by mixing with water. Many antibiotic suspensions, like azithromycin, require refrigeration once mixed to preserve their stability and potency and typically have a limited beyond-use state. Tablets, such as levothyroxine, atorvastatin, and lisinopril, are generally stored at room temperature. Always check the manufacturer's instructions for specific storage guidelines. Question 24. A pharmacy implemented a new barcode scanning system for medication dispensing. A few weeks later, a technician reports that the system sometimes fails to recognize the correct strength of a medication, leading to potential errors. This issue should ideally be addressed through which quality assurance tool? I. Pareto chart. B. Failure mode and effects analysis, FMA. C. Root cause analysis, RK. D. Fishbone diagram. Answer C. Root cause analysis, RK. This question tests your understanding of quality assurance tools used to investigate and prevent medication errors. The keywords technician reports that the system sometimes fails and leading to potential errors indicate a problem that has occurred and needs investigation. A root cause analysis, RK, is a structured approach used to identify the fundamental reasons, root causes, behind a problem or undesirable event, rather than just addressing its symptoms. In this scenario, an RCA would delve into why the barcode system is failing to correctly identify strengths, leading to a permanent solution. Question 25. What is the primary purpose of a risk evaluation and mitigation strategy, REMS, program? I. To ensure generic drugs are bioequivalent to brand name drugs. B. To prevent the diversion of controlled substances. C. To ensure that the benefits of certain drugs outweigh their risks. D. To streamline the drug approval process for expedited review. Answer C. To ensure that the benefits of certain drugs outweigh their risks. This question addresses federal regulations related to drug safety, specifically REMS programs. The keyword REMS stands for Risk Evaluation and Mitigation Strategy. The primary purpose of REMS is to manage known or potential serious risks associated with a drug by employing specific strategies to ensure that the benefits of the medication outweigh its risks. This might involve special training for prescribers, patient registries, or specific dispensing requirements, such as for isotretinoin, Accutane, or clozapine. These programs are implemented by the FDA to mitigate severe side effects or risks. Question 26. What is the percentage strength, with V, of a solution containing 15 g of a drug in 250 milliliters of solution? I. 0.06% with V. B. 6% with V. C. 15% with V. D. 60% with V. Answer B. 6% with V. This question is a basic pharmacy math calculation for determining percentage strength, specifically weight in volume, with V. The keyword percentage strength, with V, indicates that the final answer should be grams per 100 milliliters. You have 15 g of drug in 250 milliliters of solution. To find the percentage, set up a proportion. 15g/250 milliliters equals xg/100 milliliters. Solving for x, you get x equals 15*100/250 is equal to 1500/250 is equal to 6. Therefore, the solution is 6% with V. Question 27. A patient taking lisinopril for hypertension calls the pharmacy complaining of a persistent dry cough. This adverse effect is commonly associated with which class of medications? I. Beta blockers. B. Calcium channel blockers. C. Angiotensin-converting enzyme, ACE, inhibitors. D. Diuretics. Answer C. Angiotensin-converting enzyme, ACE, inhibitors. This question tests your knowledge of common adverse effects associated with specific drug classes, which is crucial for patient counseling and recognizing potential drug-related problems. The keyword lisinopril should immediately identify it as an ACE inhibitor. A persistent dry cough is a well-known and common side effect of ACE inhibitors, occurring in a significant percentage of patients. While other medications can cause cough, this specific type of dry cough is a hallmark of ACE inhibitor therapy, often leading to a change in medication. Question 28. A prescription for an antibiotic was filled, but the patient never picked it up. According to pharmacy best practices, what should be done with this medication if it is not a controlled substance? I. Return it to the original stock bottle on the shelf. B. Dispose of it immediately to prevent cross-contamination. C. Place it in a designated return-to-stock area for eventual return to inventory after a specific period. D. Mark it as damaged and report it to the supplier. Answer C. Place it in a designated return-to-stock area for eventual return to inventory after a specific period. This question pertains to pharmacy operations and inventory management, specifically handling returned or unclaimed prescriptions. The crucial information is that it's not a controlled substance and patient never picked it up. Best practices dictate that such medications should be placed in a clearly labeled return-to-stock area after a specific period, typically a few weeks, and provided the medication is still within its expiration date and was stored properly, g. unopened, not requiring refrigeration, it can be returned to active inventory. This process minimizes waste while ensuring medication integrity. Never return a dispensed, patient-specific medication directly to the original stock bottle. Question 29. Which of the following tasks is typically outside the scope of practice for a certified pharmacy technician? I. Receiving new prescriptions from prescribers over the phone. B. Dispensing medication to a patient after final verification by a pharmacist. C. Performing a final check of compounded sterile products before dispensing. D. Preparing a medication for an automated dispensing cabinet. Answer C. Performing a final check of compounded sterile products before dispensing. This question tests your understanding of the professional boundaries for pharmacy technicians, a key component of pharmacy law and practice. The keyword final check is critical. While pharmacy technicians can prepare and label medications, including compounded sterile products, the final verification of accuracy and appropriateness, the final check, before dispensing must be performed by a licensed pharmacist. This includes checking for correct drug, dose, route, patient, and beyond use date. Pharmacists bear the ultimate legal responsibility for safe and accurate dispensing. Question 30. Which of the following correctly identifies the drug class and common indication for metformin? I. ACE inhibitor, hypertension. B. Biguanide, type 2 diabetes mellitus. C. Statin, hyperlipidemia. D. Selective serotonin reuptake inhibitor, SSRI, depression. Answer B. Biguanide, type 2 diabetes mellitus. This question tests your knowledge of common medications, their drug classes, and indications, which is essential for understanding the top 200 drugs. Metformin is a widely prescribed medication. It belongs to the biguanide class and is the first-line treatment for type 2 diabetes mellitus, helping to lower blood glucose by reducing glucose production in the liver and improving insulin sensitivity. For example, a patient newly diagnosed with type 2 diabetes would likely start on metformin. Knowing these classifications helps you categorize drugs by how they work and what conditions they treat.